Just north of Ontario's largest city sits an equestrian oasis, a little farm a stone's throw from Lake Simcoe. It's here Diane Van Keulen finds comfort and an escape from what she's facing. The 61-year-old has stage 4 lung cancer.
I remember seeing the x-ray on the screen in the ER room thinking that better not be mine. Being diagnosed with stage 4 lung cancer was such an overwhelming diagnosis. It took me time to process it.
The cancer had spread to her lymph nodes, ribs, and spine. She was getting treatment, and then the pandemic hit. Diane started feeling sicker and sicker, but the idea of going to a hospital for care, the fear of getting COVID-19, it was too much. She delayed going, and unbeknownst to her, the cancer treatment wasn't working. The result? Some of Diane's tumors tripled in size.
I was my own worst enemy. I refused to go in for 4 weeks, and my body became more broken. What would have happened if I went in at the beginning? Would I be at less risk of progression?
Diane's story and stories like hers have doctors deeply concerned. All aspects of cancer care, from diagnosis to treatment, are being impacted by COVID-19.
When you say that COVID has had a profound implication on the delivery of cancer care, this is big.
Dr. Lucy Gilbert is the director of gynecological oncology at McGill University Health Centre in Montreal. She says one of the harshest realities of the pandemic, finding out you have cancer, then being told your care might be postponed.
It's heartbreaking, and you wonder, do I want to continue in this position? Because in a way, I feel you are party to a crime. We are the ones who will deal with the patients who are petrified, who are afraid, who know cancer will not wait.
According to the Canadian Institute for Health Information, from March to June 2020, cancer surgeries were down 20% across the country. Some hospitals were able to catch up, but the third wave has put all that in jeopardy. Many surgeries, even cancer surgeries deemed urgent, have once again been put on hold, and some oncologists, like Dr. Gilbert, have to meet with committees every week to decide who's sick enough to get a surgical spot.
We have to present the patients who we think are very sick and who, if we do not give them a date within 3 to 4 weeks, will come to severe harm. It's almost a bit like a lottery. I am competing with, say, the vascular surgeons who say the patient may lose a limb, or the eye surgeon who says the patient will become blind. And that's not a way we want to run a healthcare system. But this is what we do now.
How many surgeries have been postponed, would you say?
Yeah, it's in the thousands. If we're talking about all surgeries, it's gonna soon hit over 100,000. Like it's an astronomical number.
Dr. Antoine Iskander is a surgical oncologist at Sunnybrook Health Sciences Centre in Toronto. He's been collecting data on new diagnoses, oncology surgeries, and screening tests being done during the pandemic.
We saw a 60% drop in cancer-directed surgeries on the week of March 15th of 2020 in Ontario. And subsequent to that, over the next few months, we had an increase in the amount of surgery, but we never hit pre-pandemic rates of cancer surgery. But the true magnitude of the problem won't be told for some time. It'll take a year, 2 years, because there's patients we haven't even heard about that should be in the system but aren't even on the wait list yet.
Starting is 200.
That's because some people are not getting screened, so many would-be cancer patients haven't been diagnosed yet.
You wonder where some of these cancers are. Some of them are missing in action. We don't know where they are. We've seen a drop in cancer incidence rates, despite there being a very steady rate of cancers being diagnosed in Ontario over the last 10 years, and that's very worrisome.
Physicians say when people finally seek care, their cancers are far worse than if they had come in when they first had symptoms.
If you get these cancers in stage 1, the cure rate exceeds 90–95%. But we are seeing much more patients in what we call advanced unresectable stages. And once it becomes stage 4, its cure is almost impossible.
A recent U.S. study found nearly 10 million cancer screenings failed to happen in 2020 alone because of COVID. Here at home, data is still being collected, so it's impossible to know how many people will be impacted.
People are so frightened of going and seeing doctors. The likelihood of catching COVID from a healthcare facilities is minuscule because we are obsessional about following their rules. So please, please report problems in time, have your tests in time.
For some Canadians who are sick enough to get immediate cancer care during the pandemic, there have been tough decisions. More than a year ago, Don Pickering's 7-year-old son Oliver had what looked like a small bump on his neck. It turned out to be anaplastic large cell lymphoma, a rare form of blood cancer. To survive, Oliver needed a stem cell transplant. His health team in Ottawa turned to the donation registry for help.
So you can imagine, our shock and our concern, but they found 3 perfect matches. So we really felt like we had won the lottery, which was pretty incredible.
Sadly, the relief was short-lived. At this time, the pandemic was declared and the country went into lockdown. Oliver's matches were international, and because of travel restrictions and COVID-19 concerns, they weren't able to donate.
He just moved his fingers.
With limited options, the family had to ask their 11-year-old daughter, Abby, who was a half match.
And then I came home, and then my mom was there, and she goes, "So, we have some news." And then at that moment, I was just like, oh my goodness, oh my goodness, oh my goodness. And then she told me that we needed me for the stem cells. And I was like, okay, well, I just thought up all the scenarios and I thought like my brother was gonna die. So that's better than him dying. At least he has a chance to live.
When we found out that we were going to have to use our daughter's stem cells, for me, that certainly stressed me out quite a bit because now I have not just one sick child, but a second child who I have to make sure is protected and that nothing happens to her and she doesn't get COVID.
It was a risk the family was forced to take.
I still can't believe that I'm gonna do it, that I'm gonna be a stem cell donor.
After many painful procedures and lots of COVID safety precautions, Abby was able to donate.
We'll get through this and it'll be okay. So I'm just gonna stay here for a bit. Bye.
I was like, if this was Ollie, he would definitely do it for me because my brother is a very kind, compassionate, empathetic guy, and he's always been there for me.
Your sister, she was the one who gave you her stem cells. How did that feel?
She was really kind to me, and now since I'm well, we go back to brother and sister sibling fights.
Okay, ready? Rock, paper, scissors, shoot! Dad!
How is Oliver doing now?
He's doing fantastic, actually. I'm really pleased to tell you that he's very well. Daily he shocks us with what he can do and how quickly he manages to recover from all the things that have happened to him.
Laser cuts rock in half. Laser.
Oliver was one of the lucky ones. Others haven't been so fortunate. Experts say with the current state of cancer care, we're just trading one health crisis for another.
It's been described as there's going to be a tsunami of cancer cases after we get out of this COVID crisis.
I don't disagree with that. I think there will be an uptick of identifying these patients that have not been diagnosed yet. But the question is, are we going to identify them at a point where there's very little we can do? And that's what scares us. I would gladly take a tsunami of patients that needed treatment and sorting out how we would do that over patients who we've missed who now can't get treatment. And we just don't know yet how that's going to pan out.
It's so interesting that you're saying a backlog or a tsunami would be actually a good thing compared to what you think could potentially happen.
Exactly. I would almost welcome a tsunami because I think we would find a way to make it work. We'd have to be very creative and very thoughtful, and we'd have to try a few new things, but we would probably find a way to make it work.
As for Diane Van Keulen, she's had several rounds of treatment and is now on a new cancer drug.
I hope this drug just keeps working for a long, long time because I have a lot of things I want to do still in my life.
So far, she's feeling stronger. She's even gotten back up on her horse. But Diane hopes her story can serve as a cautionary tale for those avoiding care.
I'm trying to be respectful of people's fear, right? But what I've learned is fear gets you nowhere. And if you have that opportunity to go to an ER, if you have the opportunity to get treated that day, don't wait 4 weeks. Cancer can grow. You know, you've got to weigh the benefits, the pros and cons. And there definitely, in my case, were far more cons for waiting as long as I did. Learned my lesson.